Before we get started with today's episode, I wanted to let you know that we do touch on some sensitive topics around mental illness and its implications. Please take care as you listen, and if you need any support, reach out to a professional. Welcome to Head Heart Homefront, brought to you by the Barry Robinson Center, the country's leading behavioral health residential treatment center for military kids. I'm your host, Erin Lindstrom, and I'm so glad you're here. The Barry Robinson Center created this interview series to celebrate Military Family Month. We're bringing together mental health leaders to chat about building resiliency and healthy, happy families through the ups and downs of military life. We know military life can be challenging for our kids, and it can also present amazing opportunities. In these conversations, we talk about tips, tools, and techniques to navigate the highs and lows for both you and your children. The conversations have been incredible, and we are so excited to share this episode with you. Welcome back to Head Heart Homefront. I'm Erin Lindstrom, and I am so glad you are here joining us today with Lisette Burton. And before we hop into our conversation, I want to tell you that when I read her bio, I was like, oh my gosh, I think you might be my hero. And okay. B, I do actually want to share that bio, and then we will move into our conversation. So Lisette has dedicated her career to advocating with and for children and families. She and her husband are both veterans of the U.S. Army who met working at a therapeutic residential wilderness program for boys. They went on to become family teachers at the national nonprofit Boys Town, where they cared for girls in foster care and boys committed to the juvenile justice system at a family-style, community-based therapeutic residential program. After earning her law degree from the University of Maryland School of Law, Lisette returned to Boys Town and served as their vice president of national advocacy and public policy, advocating for effective federal and state policies related to the child welfare, juvenile justice, education, and health. In her current role as the Chief Policy and Practice Advisor for the Association of Children's Residential Centers, or the ACRC, Lisette provides policy analysis, practice support, facilitation, strategic planning, and consultation services to ACRC, member and non-member systems, agencies, and organizations. Lisette serves on several national policy committees, working groups, and coalitions, and she is dedicated to prioritizing the voices of lived experience throughout her work. Welcome, Lisette. I am so excited for this conversation.
Erin, thank you so much. I know that was a mouthful, and your listening audience won't remember any of that, but the bottom line is, in my work and in my personal passion, it is all about doing what works for children and families, and making sure that children and families can access, the right care at the right time.
Oh, I love that. Thank you. Thank you for simplifying too, because it is, and there's stories in there. I cannot wait to dig in and learn more. So to start us off, I would love to know a little bit more about the Association of Children's Residential Centers, and also a little bit about your journey here, if you're open to sharing some more.
Absolutely. So ACRC, the Association of Children's Residential Centers, has been around for over 65 years. And we're a member association, but we really are focused on, and our mission is all about ensuring that children and families can thrive, ideally in their own homes and in their own communities. And should they require access to behavioral or mental health treatment, including residential care, being able to access that right care at the right time. And so our members are organizations across the United States and internationally. We have international members as well. Much like the Barry Robinson Center, who is one of our members. Mm-hmm. And most of our organizations provide residential treatment at some level of care. So maybe it's a group home that's based in the community, all the way up to psychiatric residential treatment facilities, serving children and families with the most complex needs. So there's a lot of expertise within our membership. Many of our folks are grounded in the community, so they are incorporated into schools, into community behavioral health clinics, providing work at a variety of levels. And even though residential is in our name, probably over 90% of our members provide care across a continuum. Again, much like the Barry Robinson Center does as well. So they're helping folks in their own homes and in their own communities, and they're providing access to higher levels of treatment and intervention when that's needed.
Gotcha. Wow. That's pretty incredible. Like the breadth of work there and the different organizations you must touch is huge.
You're absolutely right. Our organizations are serving children and families who come to them through a variety of doors, right? So whether it's a child in a family who's having difficulties with the education system and they are referred for educational reasons, or whether there's a mental health challenge that's happening and they get referred through that way, whether there's family functioning and challenges going on and a family reaches out for themselves that way. You're absolutely right. The providers I have the honor of working with are touching all of those systems that exist across our country and touching families and children at all ages and with a variety of need.
Wow. Okay. So I imagine that many of our listeners are kind of new to learning about the world of residential treatment. And I'm wondering if we can kind of break it down a little bit. And can you tell us, you just mentioned a couple different reasons why people may look into residential care. Can you tell us a little bit more about that? And like, what is the starting point here? How and why do children end up in residential treatment centers? Why might that be best? All that sort of stuff.
Absolutely. So typically, there's a lot that happens before a family or caregivers of a child look to residential treatment. So typically, there's been some kind of community-based intervention. Maybe it's been outpatient individual therapy or family therapy. Maybe there's been some kind of in-home intervention. There are a number of evidence-based responses to help a family work through challenges that they might be having. So typically a lot has happened before a family really sits down. And when I say family, that's in the broadest sense. That might be grandparents caring for children. That might be foster parents or adoptive parents. So that's family in the broadest sense, whoever those caregivers are who love and care for a child. Typically a lot has happened before residential treatment or intervention is on the table. And so when that starts to happen, when those questions start to come up, typically I think families start with, okay, whatever we've been doing isn't working, so what else might we do? And that's when they may start to look into some sort of residential intervention. Sometimes that happens because there's an acute crisis. So I will throw out there, and unfortunately people have heard this statistic. Right now, suicide is the second leading cause of death for children 10 to 24.
Wow.
Right? It's heartbreaking. As a parent, it's heartbreaking to say that statistic. As somebody who loves and cares for kids and families, all of that is disturbing, concerning. And so we know that there are young people who end up for a variety of reasons and sometimes in an acute crisis situation. And so a family may be kind of in a crisis mode looking for some kind of a residential program to help keep their child safe. And typically that's going to be an acute care center where the stay is going to be pretty short. So some kind of a psychiatric inpatient facility that falls under this big residential treatment umbrella. And then from there, maybe a child can go home, or maybe they need something more long-term. And so there are a number of residential programs that offer a longer-term intervention, anywhere from a couple of months to 6 months to a year, to really get at the root of whatever might be going on, whether that's a history of trauma and a child and family needing to work through that, or whether that's some other mental health or behavioral health issue that takes a longer period of time, some more intensive interaction to work towards healing and recovery and change. So lots of different places where a family might enter. And I think the starting place for families is, if they can, if this isn't a crisis response, if this really is, let's try to problem solve and figure out what we need, look into the options. So I know Barry Robinson Center takes referrals, and even if they don't feel like they're the right fit, through that hotline interaction, families can get some information on what other options might best meet the needs of their child. And so definitely, it's not a one-size-fits-all. There's things to consider around geography, location. Where is a program located? What services are offered in a program? There are some that offer equine therapy, right? So working with horses. There are some that have a very, outdoor educational kind of focus. There are some that really start and were created as residential schools. So if education is the primary issue, they're set up as a school, and in addition to that, they offer a variety of other therapies and supports. So not one size fits all. What do you think might work best to meet the needs of your child and your family is a really great place to start in terms of just a general question to figure out where they might go.
Wow, thank you. And, it's so interesting because as you were describing all of that, my mind is making mental images of these different places you're describing, right? Yeah. And I think it's interesting because there's so many preconceived notions about what residential means, what it's going to look like. And even like what I was noticing was I was kind of unlearning myself as you were talking about that, from the like kind of narrow-minded, dark, scary to, opportunity and support. And like, there's all different ways this can look. And like, there's people who care out there and who are ready to help your kids as well.
Absolutely. And the key is to find a high quality residential program that can meet your needs. Right. The same way we have varying levels of doctors and schools and other kinds of services that people might seek out in the community, there are differing levels of quality with residential programs too. And so by all means, if you're a parent and you're thinking that might be something you need to turn to, you're going to want to ask some questions. You're going to want to look on the website, but also talk to somebody. Visit if you can, or if they offer a virtual visit, so that you can get an idea of not only the physical status of the place where you'd be sending your child, but also you can get a sense of the milieu, a sense of the culture of the place where they're going. There are some, I think, key questions. Any high quality residential program should be definitely youth-driven and guided by family. And so a key question is for caregivers, how much do you involve the family, and in what ways is the family involved? If you get an answer that says something like, well, you drop your child off and then we call you every other week, right. That's not a great example of family engagement and really partnering with the family, because that's ultimately, right, where a child is going to go back to. They're going to go back to their caregivers, back to their communities. And so high quality residential partners strongly with community partners, and again, not just inviting for phone calls, but really works hand in hand with families to meet a child's needs. To your point, I think that's one of the misconceptions, right? A residential intervention shouldn't be a place for a child to go. It really should be an intervention that helps a child make individual progress on an individualized service or treatment plan in conjunction with family and community partners. That's the way long-term outcomes are met. And that's another question that parents can ask. What are your long-term outcomes? Yeah. How do you demonstrate success with the young people and the families that you work with? And ask what a typical day looks like, right? Get a sense of what is that schedule? Who are the people who are going to be interacting with your child? What does that interaction look like? To get an idea of what the day-to-day might look like. And I would add, I mentioned certainly being youth-guided, family-driven. The young person, I think at all ages, should be involved in the process of making this decision. Ideally, even if they're not super excited to have to go and get some additional help, right? That's not the expectation. But the young person should feel empowered and bought in to this is a step to move towards positive change, towards growth, and towards healing for themselves as well. And so involve your child in the analysis of what they think might work for them. That should be a key part, I think, of any successful residential intervention.
Oh, those are so helpful. Thank you for sharing that.
Absolutely.
I love this idea too. Like, to me, it really sounds like the parent then is almost acting as like advocate, right? Which I think we do a lot for our children. And the 100%. Way that you talk about it, I think a lot of times there's so much fear here, right? Because are we sending our child off? Like, what's happening? There's a lot of unknowns. And I love the way you just spoke about that, from coming from a really powerful but curious place where you're learning more about the different places versus looking for the, I don't know, like the end all solution. Like, it really feels comprehensive and like you're working together and joining a team.
100%. And I think you acknowledged something in what you just said, which is there is no silver bullet. There isn't, this isn't magic. This is work. Work on behalf of the young person, work on behalf of families, work on behalf of staff and therapists and caregivers. And together, that's how progress is made. Absolutely.
Beautiful. So when I read your bio, I was struck by like the story here. There's a love story. This should be a movie, number one. But obviously, and maybe I'm making this up, I shouldn't say obviously, but to me, it seems like this work is more than just work to you. It seems like this is really like heart-centered, purpose-driven work. And so I'm wondering, can you share a little bit about that with us? Like, why is this so important to you?
I think it's funny you said like it's like a movie and there's a love story. So you're right. My husband and I had both been in the military very young, right? He entered into the Army at 17, right? Right out, and I did as well. And so when we met, that part of our lives was behind us, but we met working with young people. And I think there's something to be said, right? Some people meet through dating apps, and some people meet at church, and we happen to meet at work. I think it was an intense environment with young people who had a lot of needs, but it's the kind of thing where if you know that somebody can do that work well, it was a wilderness program. So we were going on extended backpack trips and canoe trips and working again with young people and their families. And so if somebody's doing that work and doing it well, you know a lot about them. And so you're right, that's how we met. We ultimately got married. And we continue to work together. Both of us have individual passions. For him, part of what drives him is he had a brother who was murdered at a young age, and he was just passionate about helping young people be successful. I think for me, I had a cousin who we were a kinship family without even understanding that term, right? But a close cousin who was with us for a brief period of time, my family, with ultimately with my aunts and my cousins. Our grandparents cared for him for a while. And he had a lot of challenges in life. And there's about a 5-year difference between us. But I always knew as I entered into my career working with young people, the things that I was providing, quite frankly, for other people's children, I always had wished I had been in a position to provide for him. And ultimately, he never really got what he needed. So I started, I guess, in one of my early answers to your questions about, kind of what is this all about? And I talked about the right care at the right time.
Right.
And that's something that he never accessed. And ultimately, he took his own life. It's been, 7.5, almost 8 years now. But that breaks my heart. And I want that to not be the story for as many families as possible. And so you're right. There's a personal passion around making sure that there is a full continuum of high quality services and interventions for families when they need it, so that that people don't have an unhappy ending like what I just shared for my cousin and my family, but instead have happy endings that you hear coming out of Barry Robinson Center and programs where I worked every day, where kids and families do get what they need. And so ultimately that led to, I did that work directly for a number of years, and I knew that I wanted to make sure that our policies, reflected our values at the state level, at the federal level. And so it's a privilege to get to work now with people across the country and around the world who, again, are interested in putting things into place that work for kids and for families. And so, funny, I don't know what you would call that movie, but it's been a ride, and it is absolutely the pleasure of my life to see the difference that people who work in residential programs, work in mental health, the difference that they make in other people's lives.
Yeah, that is incredible. Thank you so much for sharing so vulnerably too. I appreciate it. And I'm sorry for your loss. And it's beautiful hearing you kind of like speak about it and speak about this whole kind of like system that exists, that to many people it's invisible, right? Like we really don't look to it unless we need it. And then once you're here, it's like, oh, there's a whole world of resources I didn't know about, a whole world of people who are showing up to care for children. And I think it's pretty incredible to like see that and to just know that we're part of something bigger, and that there are so many people who do care and who show up every day, and it's on different levels, whether that's in a residential center, whether that's being someone on the phone, on the hotline, whether that's someone, showing up for an interview. Like we all have different ways of doing it. And even hearing about your journey working, in with children and then being in policy, I just love and appreciate this perspective that there's different ways to be involved and there's different ways to make a difference. And it really does, like what you were talking about before about the different ways families can look like, right? And how when we say family, that can mean many different things. And to me, this is so much about like the village that's available.
At 100%. It's an old saying, right? It takes a village to raise a child, but it's so true. And so even when I think especially about military families, right? There's a bond, there's a shared experience that military families have that's different from the regular civilian life. And so that village is another place for families to turn to, talk to other parents about their experiences or about resources that they've been able to take advantage of. And that's something else to look for, quite frankly, in any kind of high quality mental health service. Many of them now utilize peer supports. So whether it's young people who have lived experience and can help other young people, or whether it's parents or caregivers who have lived experience and can help others. That's such an important part of this. Nobody can deal with life alone. We all need help sometimes.
Right.
And certainly if your family's struggling with a mental or behavioral health crisis or an ongoing issue, being able to have that village to turn to can make all the difference in your individual sanity and feeling of competency to be able to handle this, but also ongoing, right? You may get a therapy or a treatment for a time, but that network that you build should be ongoing, and this is a place where people can turn throughout their lives.
Wow. Yep. And so with your kind of like vast experience between being a veteran, being a mom, and then being an expert in this field, I'm wondering, is there like one message that you would want like anyone who's listening to this to really like take away?
Gosh, and that's, I know that military families are going to be tuning into this. And so there's probably two messages.
Sure.
I think the first would be kind to yourself. I think especially when families are struggling with any sort of complex issue, especially if it's related to mental or behavioral health, there can be a tendency to blame, to feel guilt, to feel shame, right? This isn't, the stigma around mental health challenges, I think, is reducing somewhat, but it is absolutely still there, I think, particularly in the military, right? And so I think the first thing I would say is be kind to yourself and know that there are others who may look like they're not struggling with things, but everybody has a story, everybody's dealing with something, and be kind to yourself through whatever you may be going through. And then I think the second thing I'd love for people to walk away with is recognizing that help is available. And if you've tried, one thing or 5 things or 10 things and haven't gotten what you need, that doesn't mean that the resources or the support that you do need isn't out there and isn't available to help you. So the help that you need is there. Resources are available, and reach out because you're not in this alone, and there is something that can help improve whatever situation or challenge or struggle you might be dealing with.
Beautiful. Well, thank you so much for this conversation. Thank you for your service. Thank you for your work in this world. And thank you for taking the time to have this conversation. I think it's really, really incredible, the work that ACRC is doing. And this is just such a valuable piece of the puzzle. So thank you so much.
And Erin, thanks for having me. And thank you to the Barry Robinson Center for having this series of conversations for families and making that accessible. And I appreciate the time. It was my pleasure.
You've been listening to Head, Heart, Homefront, a production from the Barry Robinson Center, the country's leading behavioral health residential treatment center for military kids. Many times, kids with behavioral and mental health issues don't improve with typical treatment options in their community. Families may need to consider long-term residential care, and this is where the Barry Robinson Center excels. They're a mission-focused nonprofit organization based in Virginia. Their residential center is the only one in the country that works exclusively with military kids. They understand the military community, as many of their employees are military connected. Their high-quality treatment includes a wide range of services to help improve the lives of children. If your child needs additional support, check out barryrobinson.org. Navigating mental health can be challenging, and we want you to know that you do not have to do it alone. Thank you so much for listening to Head, Heart, Homefront. If you've enjoyed this episode, please let us know with a 5-star review if you're listening to the podcast, or a like, comment, or share if you're listening on Facebook or YouTube. Until next time, be well.